Welcome to the Windsor Senior Center. Thank you for being here to support our UCONN nursing students. This is our first rotation of this fall semester. This is Ashley and Paige, so I'd like to welcome them. They will be providing an educational session for you on the flu shot vaccination as well as the COVID booster vaccination. So you have your handouts. They'll be providing some information for you today, so I hope you'll enjoy the presentation. Without further ado, I'll let them take it away. Thank you, ladies.
Thank you. All right. Thanks for coming out today. Can you guys hear me without the mic okay? Yeah? Okay, awesome.
Actually, could you use the mic?
Yeah, of course. All right. So today we're here to present on flu and COVID vaccines. We've noticed throughout nursing school that education is a really big part of our job, whether that's educating our patients or the community. It just is super important. So feel free to jump in at any time with any questions or comments. Alrighty, so some basic information. Most of this you guys probably already know. There might be a little bit of new stuff in there as well, but influenza and COVID-19 are both contagious respiratory illnesses, meaning that they affect your lungs and your breathing and can be spread to other people. So unfortunately, some people are at a higher risk of serious flu and COVID complications. So one of the populations is the elderly population, those over 65 in particular, and then obviously young children and people with certain health conditions as well. We do see an overlap with the symptoms of COVID and the flu, as you guys probably already know. So we'll get into that a little bit more on the next slide. All right, so we made this handy dandy chart. You'll see in the middle there some similarities between the flu and COVID. So they're both transmitted by respiratory droplets. So you know we talk about a lot wearing your mask, staying 6 feet apart, covering your cough and your sneeze. All those things are important. And then as far as symptoms, they cause fever, cough, and fatigue, which I know can be complicated because, you know, we have those symptoms and we're like, oh, do we have the flu? Do we have COVID? The only true way to know is to get tested for that. So as far as the flu, symptoms typically begin 1 to 4 days after exposure. COVID, the incubation period is a little bit longer. So it's about 1 to 14 days after exposure. And I know you guys have probably all experienced this toward the beginning, but COVID starts and you find out you've been exposed from a friend or a family member and you're like, oh shoot, I have to wait, 14 days, either quarantine or test throughout those 14 days. So it's difficult, but important. For the flu.
I have a question.
Yeah, of course.
I go into, every store I go into, I always wear my mask.
Yes.
I stay further away from people.
Good.
In the drugstore, and see, it's not that I want to say, I say hi from a distance. That's
Yes.
the way I'm going to keep on doing it.
Yeah, that's really
I don't want to get this stuff, I don't want to COVID at all.
Right,
I don't want to catch
yeah.
that.
That's really smart, yeah.
Nope.
It's important to protect ourselves, and protecting ourselves also protects others.
Right,
so
exactly.
that's really good of you.
That's what I'm doing.
Awesome. Yeah, so the cause of the flu is influenza virus. There's many different strains, most commonly A and B, also C and D, and then obviously COVID, SARS, getting more information on that. The flu in general is a little bit less intense as far as complications. So that's most likely because of our immunity that's built up over time, and we have more information about the flu compared to COVID. It's been around for much longer. COVID complications are a little bit more severe and typically deal with the respiratory system and come on pretty quick and, unfortunately, are tough to deal with. As far as prevention, we do have the flu shot. We'll get more into that. Ashley's going to talk about that a little bit. There's a standard dose. They now have the high dose for those who are older than 65. So lots of options there. And for COVID prevention, we do, obviously at first we were just self-isolating. Now we are able to give vaccines and boosters. So that's super helpful. All right, so most of these I'm sure you guys are familiar with. So some symptoms for the flu: sore throat, cough, fever, chills, weakness, pain in the muscles, headache, and rhinitis or a runny nose. Has anyone here had the flu or experienced any of these symptoms before? Yeah.
Years ago.
Yeah. Yeah, not a fun thing to deal with, right?
No.
Yeah. Have you had the flu and any other symptoms than the 8 listed here, or mainly just those?
Just that flu. I used to be allergic to eggs. So I wouldn't take the flu. I grew up allergic to eggs. So I wouldn't take the flu shot.
Right.
But one day I caught the flu and it was so bad. I was so miserable. I said, okay, I don't, the allergy can't be. It can't give off as worse than the flu.
Yeah.
So I started taking flu shots and I was okay.
Good. Yeah. It can be really tough. There are some ways to prevent the flu. Obviously, the vaccine is the best option, but there are others. Washing your hands, wearing a face mask, eating a well-balanced, healthy diet, and exercise is really important as well. For exercise, we actually found that in particular, the circulation of immune cells roam around in the body more often, so it builds up your immunity. So there was a recent study done, and it showed that those who worked out 5+ days a week actually had a better chance of avoiding the flu. So obviously a good thing to know about, and you guys have lots of opportunities here. We got to play pickleball and Tai Chi Chuan, so staying active is helpful for sure.
So the flu vaccine actually prevents against 4 different strands, so it does the A, B, C, and D strands, and those are the most common usually during the season, so they predict which ones will be most common, and then they make the flu vaccine based off of those, so that there are the 4 different influenza vaccine viruses that are protected under the vaccine. So like Paige said, there's a high-dose version, which is currently recommended by the CDC for those over 65. It used to be around, but it wasn't necessarily recommended. It was just something that was there. Now the CDC recommends that those over 65 get the high-dose vaccine. The universal recommendation by the CDC is to get the flu vaccine during the flu season. Can you go to the next slide? Yep. So the rest of information about the flu vaccine, so it can prevent against flu, but it can also help decrease the severity if you do get the flu. So instead of getting it, really bad, you're in bed all the time, you can get it, and it's a little less severe, and maybe you have a cough and a fever and a runny nose, but you don't necessarily have all of the symptoms of it. It's really important to get it if you have any comorbidities like COPD, diabetes, and other things, especially respiratory conditions. The common side effects of the flu vaccine are redness, soreness, and swelling all at the injection site. So it may get a little red around where you got the flu shot, or maybe your arm is sore. Yeah.
All right, we have a short video for you to kind of go further into what the flu vaccine consists of. We're going to skip part
real
of
quick.
it.
Influenza. Okay, so if you don't want to feel like garbage with the flu for a week, or get your friends, family, and coworkers sick, the most effective way to prevent influenza is through vaccination, which can be done as an injection or nasal spray. These vaccines usually contain a mix of 3 weakened or inactivated influenza virus strains that are predicted to be the ones that will dominate for a specific season. And because flu viruses mutate rapidly, these vaccines are updated twice a year. So how well do they work? Well, it depends. First, high-risk individuals like pregnant women, those with a chronic health condition, or those under 6 months or over 65 years of age are more susceptible to the flu despite being vaccinated. Second, since the vaccine is based on predictions, some years are better than others. On average, though, the flu vaccine reduces the risk of illness by roughly half, from about 10% to about 5%, in terms of the likelihood of getting sick over the entire flu season. That means the average person may get the flu about 1 out of every 10 years without the vaccine, and about 1 out of every 20 years with the vaccine. So for any given year, you might decide that your risk of getting the flu is quite low anyways, so it's not worth getting the vaccine. But remember, the flu can do more than make you feel terrible. The flu can cause serious injury, even death. Also, it's worth remembering that in the 2016 to 17 flu season in the US, the most recent one where we have complete data, the CDC estimates that the flu vaccine prevented 5.3 million cases of flu, 2.6 million medical visits, and 85,000 hospitalizations. Getting vaccinated also decreases your chances of you passing the flu to someone else, like Deb with their contaminated donuts. Therefore, the more people in a community that are vaccinated against the flu, the fewer people will contract and spread the flu, and the more donuts you can eat, I think. This protects those that can't get vaccinated, like infants under 6 months old. This is called herd immunity, because the herd is protecting the weakest members. Okay, to wrap up, of course yearly flu vaccine is recommended for everyone over 6 months old, with only a few exceptions. It's not recommended for people with life-threatening egg allergies or a history of Guillain-Barré syndrome. Otherwise, since flu season generally begins in the fall and peaks in the winter, it's a good idea to get vaccinated by the end of October if you live in the northern hemisphere. That said, the vaccine still provides protection even if you get it later in the season. So, don't let it being past Halloween or even Thanksgiving be an excuse for you to not get vaccinated. If you'd like to learn even more about the flu,
Right.
Alright, real quick.
All right, so then we're going to talk a little bit about COVID. You'll see here that a lot of the symptoms are going to be pretty similar to what we talked about for the flu. Fever, cough, sore throat, dyspnea, or like trouble breathing, headache, and tiredness are all pretty common. Just depending on the strain, I know some people lose maybe a sense of smell or a sense of taste. So it is a little bit different depending on the type. As far as prevention, very similar. Wear a mask, wash your hands, avoid contact with others, stay 6 feet apart, cover your sneeze and cough, and stay home, don't travel. Obviously that's up to you and what you're comfortable with, but being thoughtful if you do end up traveling is always important. Maybe wearing your mask, maybe eating dinner outside instead of inside a restaurant, things like that make a difference.
So the COVID vaccine, like the flu vaccine, can help decrease your likelihood of getting COVID. They can also decrease the severity of symptoms if you do get COVID. It is recommended by the CDC to get the COVID vaccine and stay up to date with the boosters. And just like the flu, some of the possible side effects are redness, pain, and swelling at the injection site. So those who are immunocompromised should talk to their doctor before they get the COVID vaccine. So if you take an immunosuppressant, you have cancer, you have a serious autoimmune disease, before getting the booster or the COVID vaccine, it's important to talk to your doctor and decide with them whether or not you should get it. And those who are immunocompromised are at a higher risk of severe complications because of COVID. So you and your doctor would kind of weigh the risks and benefits of either getting the vaccine or not getting the vaccine. So the COVID booster has been updated recently to a bivalent booster, which means that it's going to protect against the old strains of COVID, but also the new ones like Omicron. So it's really important to get this new COVID booster, and the CDC does recommend that you get the new COVID booster. And on the list that you have has when the COVID vaccine is being given and when the booster is being given. So that's really important to stay up to date with.
Now we have a little short video. A lot of people have a valid concern, like how do I know this vaccine is safe? So this will go more in depth about that and hopefully make you feel a little bit more comfortable.
First came the virus that had never been seen before, and that spread faster than we could ever imagine. Now we hear there's a safe and effective way to stop it. Vaccines that will protect millions from COVID-19. But can we really know they're safe after less than a year of testing? COVID-19 vaccines may be new, but vaccines are not. We've been using vaccines to protect against infectious diseases for over a century. 2 COVID vaccines are the first authorized vaccines ever to use a new technology, but even that technology, called messenger RNA, has been tested and studied by vaccine researchers for decades. We've learned how to make vaccines better and safer, and we've applied all that knowledge to COVID-19 vaccines. We also had a head start on COVID vaccines, thanks to studies the National Institutes of Health had done. Scientists there actually created a vaccine that could be custom-made to fight different strains of coronavirus, like the virus that causes COVID. Using these studies, they were able to make a COVID-19 test vaccine just over a month after the disease was first reported. All vaccines have to be thoroughly tested before they can be marketed. During clinical trials, scientists measure and compare data on volunteers who receive a vaccine to those who receive a placebo, like an injection of saline. Most early clinical trials involve fewer than 3,000 volunteers, so it can take a year or more to get the data needed to measure how well vaccines work. Early clinical trials for COVID vaccines enrolled at least 30,000 volunteers each, so data on safety and performance were collected and analyzed in under 4 months. Vaccines are usually developed one step at a time, and companies wait until they have final approval to start manufacturing them. But addressing this pandemic couldn't wait, so government and industry invested millions of dollars to produce vaccines at the same time their test data was under review. This meant health departments and clinics started getting vaccine shipments a few days after the Food and Drug Administration's rigorous standards for safety were met and the vaccines were authorized for public use. Thanks to extraordinary advances, science, industry, and dozens of government agencies have been able to work together to produce and deliver safe and effective COVID-19 vaccines in record time. Decades of experience and innovation led to this achievement, one that can keep you, your family, and your community safe from a serious and dangerous disease. Learn more, cdc.gov/coronavirus.
So some important ways to stop or reduce the spread of either COVID or the flu are to get the vaccine for COVID or the flu, and besides that, the most important thing is hand washing. It's super important to prevent the spread of both the flu and COVID-19. Hand sanitizer can be used if hand washing is not available, but you want to make sure it has 60% alcohol or more. It's also important to wear a mask if you feel that it's necessary or you're in an area of high contact, especially in areas of high contact. That's much more important than it is in a smaller setting with people you know. Maybe a home gathering isn't as important if you don't feel that you need to wear a mask, but if you're in a big setting with a few hundred people, it's definitely important to make sure you have a mask on. You want to make sure that you're covering your coughs and sneezes with a tissue or your elbow so that you're not getting droplets everywhere and causing the spread of the virus. It is also important to clean high-touch areas like doorknobs and light switches and tabletops. And you want to stay home if you have the flu or COVID so that you're not spreading it to other people. And you want to also move larger activities with a few hundred people outside so that you're not all in a small, tight space without great ventilation. And if you do have to have these large activities inside, you want to make sure you wear a mask.
Also, they send out tests for home tests for COVID to seniors for free.
Yeah, you want to make sure that when the government has those things, because I know that there were a few.
I just got some a couple of weeks ago, so I think they're sending them out now.
Yeah, and if you can register online too for more COVID tests. I don't know if they're still doing it, but I know they were. And you can also get them at the pharmacy, and a lot of the times your prescription insurance will reimburse you for them when you buy them.
Well, these are free that they send out.
Yeah,
I know.
They send out 2 per person.
Yeah,
Yeah.
I know that my family was able to, we have 4 people, was able to get 8 tests at one point. So it's definitely important to make sure you test if you think that you have COVID, especially because there are at-home tests and you don't have to go to the doctor to get a test. But if you really think you have it, you can definitely go to the doctor and get a test. And for flu, you can go to the doctor or an urgent care or something like that and get the flu test.
All right. Now we have a little bit of trivia for you guys, just about 5 questions. Some of them are pertaining just to this area, some more to the state as a whole.
So the first one is, what % of Windsor has at least 1 dose of the COVID-19 vaccine? 69%, 93%, 74%, or 87%?
I'd say B.
D, 93%?
How do you know?
I'll tell you on the next slide. Just taking a guess for now. All right, so as of 9/21, 87.34% of Windsor has at least 1 COVID vaccine. So that's a pretty solid number. I know where I'm from, it's in like the low 70s, so not as much coverage. So it's good to know these things.
That's good.
So which area has the highest % of coverage from COVID-19? Windsor, Windsor Locks, East Windsor, or South Windsor?
Any guesses?
South Windsor.
South Windsor? Hey, that's a good one. South Windsor is the winner for this. Lucky guess. It has 91% coverage. Windsor isn't far behind with 87. Windsor Locks has 75, and East Windsor has 72. And then we have this handy dandy graph over here. You'll see the areas that are darker blue are more vaccinated, and then the areas that are lighter blue, unfortunately, aren't as well vaccinated.
What number of COVID cases have been reported among CT residents in the past 7 days? 1,052, 2,007, 3,632, 4,121. Anyone got a guess? No?
About 3,632 Connecticut residents have reported confirmed probable cases in the past week. Obviously, those numbers are a little bit lower than when the pandemic first started, which is great, but obviously you can see it's still a pretty big issue in our state, country, world. So we'll keep taking the precautions. Hopefully, those will all be done soon.
What number of patients are currently hospitalized with COVID in Connecticut? 123, 277, 376, or 399? Anyone have a guess?
All right, 376 patients are currently hospitalized in Connecticut with COVID. And of those patients, an interesting fact, about 36% of them are not fully vaccinated.
From the start of the pandemic, how many COVID cases have been reported in Connecticut? 602,567, 711,246, 764,345, 893,529.
So almost 900,000 cases have been reported in Connecticut since the start. Has anyone been lucky enough not to have COVID yet? Yeah, same here. Yeah, good. Yeah, it can be tough, to prevent, but we can only do what we can control, and hopefully it'll all be over soon. All right, here's just 3 helpful resources. Obviously, the CDC has some great information. I'm sure most of you are familiar with that. We have a link here to find flu vaccines. It's super helpful if you don't know where to go. So you can type in your zip code here and then click whichever vaccine you're looking for, and then we can search for vaccines and you'll find different places you can go to get vaccinated. And then lastly, Windsor has a great source for you guys on COVID-19 data. You'll see here, this is what I used earlier. So I am from somewhere around right here. So we are only 71% vaccinated. This area over here is doing a little bit better. So, and then Salisbury is 100%. But some helpful resources for you. And then lastly, we do have an amazing opportunity right here. So the standard dose of flu shots are available by Windsor Health Department, and then the high dose for those of you over 65 are available by Stop and Shop Pharmacy. And that's going to be next Thursday, October 6th from 8:30 to 12. So we have more information on that in the back there. Feel free to check it out. It goes over insurance and what to bring, anything like that. So, any questions or comments for us?
Thank you.
Awesome.